So I myself, Masood Ahmed, I'm a clinician by background. I worked in the West Midlands. I was a negotiator for the BMA, then I went to a software company, then I went to Dell, was managing director for the UK, was then global medical director. So I got to see a lot globally. I then realized that actually that didn't nourish my soul very well. And so I came back to the public sector, and really the last couple of years I've been in the innovation scene. So I worked with Tara Donnelly at the Health Innovation Network and was the Chief Digital Officer for a while. And currently I work on a number of projects with UCL Partners, with Digital Health London, and with the Department of International Trade. So I see things from a number of different perspectives. Just a quick word about Digital Health London. It's really a program that covers London, but it brings together a lot of organisations. And really the only reason I'm showing you that is because the key to innovation is ensuring that while you recognise individual talent and priorities, that there is a huge collaborative element that is essential to make innovation work. And I think you've said it yourself, that it's really important that as a region, one, we have that ambition, but two, we have a strategy and we know where we're heading. And we do that, we're on that journey together. In terms of where we sit, I know we've got the AHSN network talking a bit later. And again, I would say from an innovation perspective, in terms of insight, in terms of adoption and spread, they're a key organisation. In terms of our priorities, those are standard. I'm not going to talk much about that, especially as I know you're going to be keeping time.
That's right, you're doing fine.
AI, how will it impact us? So for me, when I look at innovation, I think of it in really two different ways. I think the part that people often focus on is optimization. They always think about how can we do things better. And actually, doing that, the things that make things better, I think it gives us progress. But actually, the real impact will come from disruption. So in terms of what we're already doing with AI, actually there are a number of areas. Diagnostics. We're seeing the idea of pattern recognition, looking at X-rays and assessing them, and actually understanding what the trends are. And machine learning that's being applied in terms of diagnostics is getting better and better. In terms of electronic health records and natural language processing, I was speaking to one of the CCIOs earlier, and one of the challenges in the region is to have a system, a health record that actually is robust enough from a data integrity perspective and from a perspective of accessibility, where actually we have the right data that we're able to then use for analytics purposes. So again, I know that's on your roadmap. Robotic surgery, decision support. I'm going to pick up on the decision support, because for me, as a clinician, that's a really interesting one. In that there's a bias that's introduced when we look at decision support tools, and there actually is a significant risk. I was chatting to Paul from my pre-op, and actually, they're doing a fantastic work in the sort of the pre-op arena, and at the moment very much focused on sort of decision tree algorithms to help us make those decisions. But actually, the real power of a system like that will be the wealth of data that they have, and being able to then model AI to help with those decisions, so that we can really then lessen the burden on our workforce. And workflows. We just don't have enough people. We have an increasing burden from patients. So the patient flow, the workflows, all of these processes, they need to be optimized. And I think we've probably spent the last 20 years where people have talked about lean and Six Sigma, having black belts and green belts and all that stuff. The truth is that's not enough. I think everyone within the NHS has kind of been doing that and done it really well. So for me, that's why the optimization piece, while it's ongoing, the bit that I'm excited about is the disruption. And I think the disruption side of things is where you have the game changers. Ideas that often are very simple in terms of the concepts, but they're applied in, they're on point. You look at Uber, you look at sort of Let's Eat, you look at Airbnb, and you kind of think to yourself, cracky, why didn't I think of that? It seems so simple and it makes sense. But these are approaches that, if you like, flip an industry. And I think it's the disruptive element, which is where AI can really make an impact. And for me, that's the exciting bit. So when we look at things like biopsies and virtual biopsies, at the moment it's very much a physical process. However, once we start to look at the scanning and the imaging that we have, and we start to look at how we can apply AI algorithms to that in terms of not just pattern detection, but also from a predictive perspective, we will start to see things that actually we weren't aware of. So being able to biopsy without actually having to stick a needle in or to cut, I think will be the way forward. And actually it is happening. You know, there is work around sort of neurosurgical sort of biopsies that occur. All over the world there are examples of these things happening. Speech and video. Part of it is that we don't have time. We are overwhelmed. Herbert Simon is a world-renowned sort of economist. And what he said is that in an age where we have a wealth of information, we have a poverty of attention. And I see it all around me, you know, I see it with my kids, that there is so much going on that you're bombarded with this information and this data. And in a way, you just don't know what to do with it. And so we are pulled in different directions. And that's very different to the model that I grew up with when I was training to be a doctor, where actually it was about focusing on what you heard, what you saw, when you examined a patient, pulling together those different perspectives, but you had time. And I think we are going to need to leverage, if you like, the visuals and in terms of speech recognition and changing that into actionable insights, rather than, if you like, just quoting people verbatim. So natural language processing is fantastic, and you've got, well, I'm working with some companies that actually are doing that, where they will scan reports, and these are often verbal reports that have been transcribed. But the key is actually how do you pull out those little bits of information, and it's that sort of sentiment analysis. And equally in healthcare, we have a real challenge, because it's not just about recognizing words, it's the constructs. So an example would be that if someone was to tweet that, you know, had a terrible accident, went to the Royal Cornwall, nurses were fat, that's actually a positive statement. But in terms of early AI, when that analysis would occur, it would pick up on the words terrible. It wouldn't necessarily understand fab is good, and that was contextual. And so when we've got this information, it's not just about what it is, but it's about how we analyze it and we make sense of it. And I think that's where AI will start to really have an impact in terms of disruption with speech and with video. Genomics. There are so many sort of areas of genomics which are progressing. You know, we've gone with, I think, a 10-year space from being able to understand and analyze the human genome and it costing sort of over $1 million to now costing a couple of thousand. And the information that presents us and how we then use that genomic information to provide us with a foundation so that it almost becomes an information data set where we can start to hang different bits of other information. And it's that layering of the various data sets that's going to be really important. But again, we are talking about huge, huge data sets that certainly as humans we can't even begin to comprehend. And I'm not sure we should even be trying to. Accessibility, I think that's quite a key. And you said one of your priorities exactly is that how do we ensure that we are connected and having that connectivity, but also making sure that we've got connectivity that is fast enough to accommodate the data and actually for things to be instant. So whether we talk about edge computing and bringing that process, you know, distributing that processing power, or whether we talk about blockchain. Again, you know, talk to Paul at the back of pre-op. We were talking about what the future holds and, you know, personal health records, and actually utilizing a principle such as blockchain, which sometimes has a bit of a bad rep because people think about cryptocurrencies and like, oh, I don't know about that. But actually, as a principle, having a single source of truth, if you like, makes sense. Often, if I speak to patients, they're a bit shocked when they realize that we are so disconnected in terms of a healthcare system. And strategically, I know we're moving towards integrated healthcare systems and so on, but actually we need the infrastructure to support that as well. And then remote monitoring. You know, we're being monitored all the time. And that I think will get better. The question is, when we're collecting all this data, how do we bring it together and how do we make sense of it? So that for me, I think it's the disruption part, which I think is really key. And what I was really pleased to hear was Kate saying that, you know what, in this area, we are a test bed. Meaning that actually we do have that ambition and we are open to innovation. And that's actually quite a bold statement, because in the NHS, we have so many other priorities, competing priorities, that it's very easy to pay lip service to innovation because it's nice for PR and so on. But I think, in this room, the purpose of today is to think about the future. But then also, I think it's to hold Kate to account, because you guys are going to be driving that strategy. And so when you've got a chief exec that says, we want to innovate, don't miss that opportunity, because there are plenty of chief execs that I've spoken to that actually say, yeah, it's cool and we should be doing it, but there's too much else going on. Just a quick slide in terms of healthcare investment. AI in healthcare is becoming the most invested area in terms of startups and venture capital. In the second quarter of 2019, I think there was something like $860 million invested in startups. I think in AI last year, there was around $9 billion that was invested. So there's a huge investment in AI. I guess the question is, do we want to be part of that journey? And if we want to be part of that journey, we have to create an environment that is supportive of innovation, to allow people that are, essentially to allow ideas to flourish outside of, if you like, the typical centers, such as London and sort of Silicon Valley and New York and so on. I'm now going to talk a little bit about, if you like, some of the problems that come about with AI. And I don't mean sort of, the Terminator kind of problems. I mean the simple problems that often we're not aware of. So risk homeostasis is an interesting concept that I was reading about and how it applies to AI. And really, risk homeostasis is about when you reduce the environment in terms of risk, you would assume that it actually makes things better. But actually, studies have shown that when you reduce the risk, our behaviors change, in that actually we start to get a little bit more heavy-handed. We kind of take our, how do I say, well, I'll give you an example. Anti-lock braking systems. The idea about anti-lock braking systems is that you can slam on the brakes and you know that you'll be brought to a halt much sooner, and therefore it will, reduce accidents, etc. Actually, a consequence of anti-lock braking systems is that people now drive closer to the car in front. And so while you'd think, it does have an impact, and it does have an impact on safety, actually it also creates a behavior that was unintended. It's similar with seatbelts. That actually, in terms of seatbelts you would have thought would have a big impact on death. Actually, it doesn't. It does have an impact on injuries. So the injuries sustained from accidents in cars since seatbelts were introduced have reduced dramatically. But in terms of people dying, because there's also been a sort of a shift in terms of how people drive, there's been, the rates of serious injury and death hasn't decreased as one would have hoped. And I guess that leads me on to the idea of the case of Pablo Garcia. So those of you that have read The Digital Doctor, Bob Wachter wrote that. and he did a report for the NHS a few years back around sort of the digital environment and what are the things we should be thinking of and how we should be engaging in a new digital world. And one of the examples he gave was about a teenager called Pablo Garcia, who suffered from a rare sort of condition where he would have epileptic seizures. And he came into hospital and he was given a drug that was 38 times the dosage that it should have been. And that was in spite of going through 50 different checks. And what was interesting is that as clinicians, we have what's called a sort of decision momentum. So if someone says to you, yeah, I've checked it, and says, can you check it? The truth is that a lot of people check it, but it's just a cursory glance. And it's almost like, well, yeah, you've checked it, and I know you, so if I check it, yeah, I'll be fine. And what's shocking is that, this went through 50 different identifiable checkpoints, this process, and ended up with this patient getting 38 times the recommended dosage of a drug. And we see this, it happens quite often, this decision momentum. And so what I would say is that when we're looking at decision support tools, keep that in mind. And the reason for that is we get what's called automation bias. And an automation bias means that the more we kind of create systems and pathways and everything's done for us, we sort of almost stop thinking. And we trust what we're told. And the more, and one of the key problems is actually that everything is in a black box. So a lot of clinicians are very wary of the decision-making process. And part of that is because we don't have clarity in terms of how those decisions have been made. And so when you've got AI systems that are telling you, everything's okay. And I think an example I was reading about recently was the difference in terms of if you're male and female. And if you're getting chest pain and you're male and you're a certain demographic, it'll say you're having a heart attack, or you may be having a heart attack, be checked out. And if you're female, it's like, well, that's a bit of heartburn. And as a doctor, you think, well, hang on, how did a support tool that's powered by AI come to that conclusion? And then we kind of are a bit resistant to that because we think, actually, what doesn't make sense, and therefore we don't engage. Whereas actually what we should have is perhaps more transparency in terms of that process so that we can understand it and it's not black box, because then we can feed into that. And some of the errors that come out are actually sort of commission and omission errors. And when I say commission errors, what I mean is that we act in error because the computer says that this is what we should be doing. And therefore we don't challenge that. And that can lead to errors. Equally, we get what are called omission errors. And what happens is that when we start to rely on tools that are telling us what to do, when they don't tell us an answer, we actually hesitate. And there's an increased risk of us failing to act because the computer hasn't given us an answer. And it is pretty much the computer says no scenario. But we don't question it. That whatever the computer says, yeah, it must be right. Why? Well, because it's a computer, it's been programmed. And I think what I would say is that any strategy you have that involves an emerging technology, please question it. Because when you question it, what you're doing is you are ensuring that actually there is a robust system in place regarding governance and so on, but also in terms of development. Every innovator is always looking at what's the next stage, what's the next iteration of improvement. And therefore, it's very important to just recognize those concepts and realize that actually we're fallible. And while we can have a lot of confidence in what's going on, always be cognizant of the fact that there are going to be times when if you have a hunch and if you've had years of experience and you know that actually that doesn't quite sort of feel right, to challenge that. It's sometimes referred to as the blink factor. Malcolm Gladwell spoke about it. That sometimes through your experience you'll see things. You'll see a patient come in, and you'll just know there's something not quite right. So always, follow up on that. I'm going to now move on to another piece of work which I did recently. So as part of the UK government's industrial strategy, 7 data innovation hubs were set up across the UK. UCL Partners actually won the bid for the data hub for cancer. Actually, University of Exeter is one of the partners. And it's really just to sort of tell you in a practical sense what's happening. So the first part was really about, in fact, some of the conceptual principles that I find interesting. This bit is more about sort of what's now happening. Now, it's very early stage. So the bid was only announced, or the win was only announced in September. And so UCL Partners are building the team that are going to deliver this and create this hub. But really, what it does is it creates a landscape and it creates an infrastructure where we start to pull in the various data sets that relate to cancer. And that's one of the big problems that we've got with, well, one of the problems, but also I'd say one of the opportunities. That in the UK, in the NHS, we have this really rich data set. But again, it's overwhelming. How do we structure that in a way where it can then be used effectively? And that's one of the things that the data hubs are doing. So really, there are a couple of elements to that. One is about collating that data, aggregating it, cleaning it up, making it useful. The second is, if you like, giving patients access to that. So again, it's not just about the research side of it, but it's also in a practical sense. As consumers, we expect that in every other industry. And I think what we should be doing is also move to a similar sort of model of expectation, that if we can do everything else on our mobile phone, why can't we do these things, in healthcare? There's no real reason why we shouldn't. But we do need to have, if you like, systems in place that will underpin that. But also we will gain insights. If we're moving to a model of value-based healthcare, what does that mean? How do you quantify value? And so really moving away from specific point targets, because every target that you look at, it's often in isolation. It's actually when you start to pull the various perspectives together that things make sense. And I think value-based healthcare is a really good catch-all for any initiative that you have, because it focuses on outcomes, it focuses on, if you like, cost and efficiency, because ultimately it does cost money to run a healthcare system. It focuses on patient experience. And again, that's quite an interesting one, because often we will focus on the clinical outcomes and the markers that will determine success in that respect, but we don't necessarily, we like to think that we're taking a holistic approach, but we don't always recognize the patient experience, or we don't know how to manage that, how to assess it, how to track it. And then the fourth, if you like, part of value-based healthcare is around those frontline staff. How do we make life easier for them? And so I think in terms of an initiative like this, it starts to move us towards that more of a value-based healthcare model. How am I doing time-wise?
Got 20 minutes.
Because like I said, you had
You're
me
doing
worried.
right.
Okay. Now, this was very much an early discussion document around what the strategy should be. So please don't take it as being the actual strategy that will be followed. I think when you're making putting forward a proposal, the idea really is to say, well, just share some of your thinking about how you might take this forward. And really, it's a twofold strategy. And the work I did on this was actually with a colleague who is far more knowledgeable when it comes to AI than me, but very much from a behavioral perspective and sort of looking at sort of errors and so on. And what we developed was, if you like, two strands to this. And one was around improving the data. The other was around sort of how do you kind of make that then data accessible? Because one of the things that if you're in the sort of tech world, the idea of garbage in equals garbage out. And so again, it's not just about collecting all this data. Part of it is about cleaning up this data. Part of it is about filling in the gaps. Part of it is about using some of the predictive models that we have to actually strengthen the data sets that we have, because sometimes you can fill in the gaps. And I think once this is where AI will start to really play its part. But at the moment, we have models that support narrow AI. And when I say narrow AI, I mean they're fairly well-defined objectives, and we can do those things. We're not yet in the area of general AI. And general AI is when actually things start to get pretty clever, where you start to create neural networks and you start to access data in a way which it's very difficult to sort of imagine. But that moves more towards, if you like, computers telling us things that we wouldn't have seen, or would have taken us, decades, if not hundreds of years to realize. One of the things is that I think AI will help with is that with narrow AI, we'll focus on solving point problems. But actually, as our AI systems progress, what you'll find is that those individual point problems that you solve, when you start to bring that together, and you start to weave together the different outcomes from different initiatives, what you start to see is that has a synergistic effect. And so the hope is by starting to bring those point solutions together, you'll start to develop an AI strategy that actually starts to go into areas which I suspect will be more disruptive. Governance, I've spoken about the black box scenario. That's really key. And I think that's a real struggle, because at the moment, I would say technology is way ahead of where we are. And so keeping up with that is a real struggle. I don't know what the answer is. I know that recently NHSX have released a document that tackles a number of these areas. I haven't read it yet because it only came out this week, but I've heard it's good. And I would recommend reading it because I think it starts to give you an overview. But what I would say is that in terms of this journey, we're very much still in early days. And so whatever you read, don't take it as gospel. What I would say is that there are many people that have many different perspectives, very different skill sets, and I think contributing to the discussion is extremely important. And in terms of the strategy, really it's about helping the research element. If you can fill in the gaps, if you can start to aggregate that data, if you can start to anonymize it, make it accessible, actually that will be a really powerful tool for a number of different partners that will want access to that data. And I think that's one of the key strengths we have in the UK, is that we do have, if you like, a national model of healthcare. And once you start building the infrastructure that supports that in a regional and then in a national way, that's where I think the advantage will come. And that's, I think, the biggest advantage we have over many of our international, if you like, colleagues in other healthcare systems. I've talked about this a little bit in terms of it filling in some of the gaps. The other thing is to understand how not to waste data. Because at the moment, we're almost, we're so hungry to collect various data points, whether it be through our Fitbit, whether it be at home and motion sensors, whether it be, little black boxes in our car that monitor our driving habits, etc. The key is going to be actually, it's okay to collect that data, but don't necessarily think that it's going to be used right now. I think the models that will develop in the future will understand how to leverage that information. And hopefully what will happen is that as you improve the data that's aggregated, you'll be able to determine where the priorities lie. Because the truth is that healthcare is very complex. Where do you prioritize? Which conditions do you prioritize? And what you may find is that there are certain areas where we're getting clues and we're making progress faster than others. And I think part of having a data hub and a national data hub is that collectively we'll be able to we'll see patterns of where progress is being made. And it may well be that we prioritize those areas, simply because by prioritizing on those areas, that will build a model that will then be applicable to the other areas. And so again, it's understanding that in order for us to really take advantage of the opportunity AI presents, we do have to be strategic. And we are going to have to make some tough decisions about where our focus will be. And then in terms of research, there's a lot there. I mean, it's standard. Julia, I think, are you going to be able to share the slide decks?
Yes.
So within the slides, there are some links. And actually, I think I've covered all of that. Here's the next slide. In summary, yeah, we're not going to build a sort of a deep mind or a Watson. What I would say is that certainly, you know, the idea of an all-knowing, all-seeing AI system that will be able to tell us everything is great. It's not going to happen for a while. I think the focus really is how do we get AI moving in very specific areas, and what's the learning from that, so that we can then start to build on that model. And it's about integrating those different modules and creating a bigger AI system that will benefit us. And at the moment, I think while it is very much uncharted territory, I think there is a huge opportunity. And I think that what I would say is don't be fooled into thinking that, you know, there are other centers of excellence where that's where all the thinking is going on. What I would say is actually, you know, everyone brings something to the table. So if you're creating that environment of innovation and creating that culture, actually, I think that within the Southwest, you do have a huge opportunity. You have various centers of excellence. And so encouraging that input and that discussion is really important. I'm just going to finish off with the document. So that effectively is the document that came out this week. There is a link there to it. And really the way in which that's structured is the standard stuff. Now, I haven't covered the standard stuff because I thought if you really want to know about it, you can go and read about it. Hopefully I've given you a different angle to how AI will play its role moving forward. And I hope that will help in terms of the discussions later on.